Hello, everyone. Good to see you again. Thanks for stopping in to see us. We're going to be talking today about hormone replacement therapy for women, which is a very big topic and one of the main things we work with in our practice at the Institute for Progressive Medicine. There's actually two other physicians here, Dr. Zuzowski and Dr. Wittenberg, both of whom also work with hormone replacement because it's a very valuable thing for people. In women, what occurs is menopause, which is about the age of 51 on average in this country. And at that time, the ovaries just stop working. So they're not making estrogen, they're not making testosterone, and the woman becomes depleted of these hormones, which results in a lot of symptoms. The most popular one, that's the one we like the most because it has the greatest effect, is these pellets that we insert underneath the skin. And they'll sit there underneath the skin, putting out hormones for 3 or 4 months. And they will maintain the same level of hormones throughout the day, at night, weekends. I think it's a really good way to maintain hormone balance and make a person's life go better. And the relationship with the significant other also goes quite a bit better, we find. By the way, we also have a procedure that you can watch on our main page of Dr. Wittenberg inserting pellets, because she does this quite a bit as well. So I would urge you to look at that and see what the procedure is like. Well, thanks for listening. And if you're interested in this, give us a call at the Institute for Progressive Medicine, 949-600-5100. We're located in South Irvine, and we'll see you when you need us. Take care. Bye now.